So I made 500 flashcards to help me pass my paramedic exam. Was it overkill? Probably. Did it work? Yes. Each episode, I'm going to be running through 10 cards, giving you 5 seconds to answer each question. Afterwards, we'll review each question with a bit more detail and some diagrams. My name is Zach, and this is Paramedic Zach. So keep in mind that these cards are in no particular order. They're not categorized, and some might seem more important than others. Also keep in mind that the answers to these questions might differ based on the systems you work in and the protocols you use. Alright, so question 1. Beta blocker overdose can be treated with glucagon at a dose of blank. Alright guys, so you're going to treat your beta blocker overdose patients with 2 milligrams of IV glucagon. Question 2. A left bundle branch block will present with a dominant S wave in which lead? So you're going to look for a dominant S wave in lead V1 when you suspect a left bundle branch block. Question 3. If after endotracheal intubation you hear clear lung sounds over the right lung and diminished lung sounds over the left lung, what should you do? So if you're getting clear lung sounds on that right side and diminished lung sounds on your left side, what you're going to want to do is pull back on the ET tube 1 centimeter at a time until lung sounds return to normal on both sides. Question 4. What is your adult intramuscular epinephrine dose? As a lot of you might remember from EMT school, your adult intramuscular epinephrine dose is going to be 0.3 to 0.5 milligrams of a 1 in 1,000 solution. Question 5. Name the anatomical locations of each lead on a 4-lead ECG. Alright, so your white lead is going to go on your patient's right bicep. Your black lead is going to go on your patient's left bicep. Your green lead is going to go on your patient's right calf. And your red lead is going to go on your patient's left calf. There's a great little thing to remember this. It's called whitey-righty, which simply means that your white lead is going to go on your patient's right side. It's going to be the uppermost lead, and the way to remember that is snow over grass. That is, your white lead is going to go above your green lead. Same on your left side. You can remember it by smoke over fire, meaning that your black lead is going to go over your red lead. So your black lead is on your left bicep and your red lead is on your left calf. Question 6. Name 3 rhythms in which synchronized cardioversion is indicated when the patient is hemodynamically unstable. So the 3 rhythms that you're going to cardiovert are 1. Unstable supraventricular tachycardia, or SVT. 2. Unstable ventricular tachycardia, with pulses, of course. And 3. Atrial fibrillation with rapid ventricular response. Alright, so question 7. In the proper order, name the 4 things that you're going to do to treat CHF. Hint. Device, med, device, med. Alright guys, so the first thing or the first device that you're going to use is a non-rebreather with high flow oxygen. The first medication or the second thing that you're going to do is administer nitroglycerin at a dose of 0.4 to 0.8 milligrams sublingually. Now I have added a 2.5 to this flashcard because alternatively you can give 1 inch of nitroglycerin paste if your CPAP has already been applied and you don't want to break that seal to give sublingual nitroglycerin. Now thirdly, if you haven't done so already, you're going to administer your CPAP. And number 4 is going to depend heavily on the systems that you work in. You might be giving nebulized albuterol via an inline treatment at a dose of 2.5 milligrams, and you might be giving Lasix IV at a dose of 40 milligrams. Nebulized albuterol is going to dilate the bronchioles, and Lasix is going to help rid that patient of excess water by peeing it out. All right, question 8. An infant who is less than 2 months old is considered febrile with a temperature greater than or equal to blank. All right guys, so for an infant who is less than 2 months old, a fever is going to be considered 100.4 degrees Fahrenheit or greater. Question 9. Name the breathing pattern. Alright guys, so this breathing pattern is indicative of a brain stem injury and is known as apneustic breathing. It's characterized by a prolonged inspiratory phase followed by a pause and then a short ineffective exhalation followed by another pause. In question 10. Treat chest pain with nitroglycerin at blank milligrams sublingually to a max total dose of blank milligrams, keeping the systolic blood pressure greater than blank. Alright guys, so to treat your cardiac-related chest pain patients, you can give 0.4 milligrams of nitroglycerin sublingually. You can give this up to 3 times to a max total dose of 1.2 milligrams, as long as the systolic blood pressure remains greater than 100. I've seen this number vary from system to system, anywhere from as low as 90 to as high as 120. Alright guys, so that concludes the rapid fire portion of the first episode. If you'd like to get a bit more in depth with each question, be sure to check out part 2, which is going to be somewhere over here. If this video helped you in any way, please do me a huge favor by tapping the like button. And if you'd like to get these videos regularly so they can help you pass your paramedic exam, please click the subscribe button below. Take care, and I'll see you guys next time.